When you come into Medicare, the biggest decision you're going to have is right off the bat. Do I join a Medicare Advantage plan or do I stay on original Medicare with a Medicare supplement plan? This is easily the biggest decision. They are completely different in how they function. Most people don't really understand that. I'm going to go through right now 3 main reasons why I personally would never join a Medicare Advantage plan. So you see all these TV commercials with the celebrities and the quarterbacks and the sports stars, and they're all hawking Medicare Advantage plans, trying to convince people how great they are, the free stuff they give, and it's a misunderstanding on how they function. So I just want to make it clear on why I would never choose Medicare Advantage. I would always do whatever I could to stay with original Medicare with a Medicare supplement plan. And it's really quite easy to understand. Number 1, provider networks. It's a big one. When you're with a Medicare Advantage plan, you have a network of providers, doctors and hospitals that you have to use. And they can be very limited at times. In bigger cities, they may have a larger breadth of doctors and hospitals to choose from. But for the most part, it doesn't give you the choice that you would want if you're in a significant medical situation. So provider networks can be very tight, and when you try to make an appointment with a doctor, what you'll find is when you're calling to make an appointment, let's say you've got something that just came about that you're quite concerned about, you want to get to see a doctor this week, if not tomorrow, and you call to make an appointment, and they will tell you the first availability is 2 months from now, maybe even 3 months from now. What will happen is you will likely end up seeing a nurse practitioner instead of a doctor. And I certainly have nothing against nurse practitioners. They probably work harder than doctors do. But when you're facing a significant medical challenge, you really want to see the doctor as quickly as you possibly can. But in a lot of Medicare Advantage plans, it's very difficult because they have a limited number of doctors for the mass population to utilize. And that's where the cost savings come in for a Medicare Advantage plan. Another issue with providers in Medicare Advantage plans is they change every year, sometimes in the middle of the year. Doctors opt in and opt out of Medicare Advantage plans. So if you're in the middle of a significant medical situation and your doctor leaves your Medicare Advantage plan, then he leaves you as well. So he will need to find a new doctor at that point. They would likely, hopefully, refer you to someone that has some understanding of the things that they've been doing, but it's absolutely a scenario that can be very complicated and absolutely very stressful when it comes to having a significant medical condition. Something else in related to doctor networks and having to use certain doctors in certain hospitals, sometimes I get pushback where they have PPO plans. So they're not all HMO plans. If you're on an HMO plan, you have a specific, usually very limited doctor network, very limited hospital network. There are Medicare Advantage plans that are PPOs, where they have out-of-network benefits, so you don't have to stay within the network to use them. But what you will find is it's almost smoke and mirrors, because to go out of network, it's significantly higher in out-of-pocket cost. They will show generally a much higher maximum out-of-pocket limit when you use out-of-network benefits, but also the co-insurance amount is significantly higher than if you use in-network benefits. Now, something to understand, going out of network, if you find a doctor, number 1, that would accept you coming as an out-of-network patient, most will not. First thing that happens when you're making an appointment is they check your insurance. And if they don't take your insurance, they don't take you as a patient. But if they did, there's no agreed cost between the doctor and an insurance carrier. In other words, there's no limit to what they can charge you. So if you did use out-of-network benefits, you found a doctor that would actually see you as an out-of-network patient, the insurance carrier is going to pay X amount to that doctor, what they would consider usual and customary. That doctor likely is going to charge more than that usual and customary. So not only are you going to pay a higher percentage of that usual and customary, you're also going to be responsible for the balance that's not covered by what the insurance company thinks is the fair price for whatever services there may be. So very complicated when it comes to using out-of-network benefits. And God forbid you end up in an out-of-network hospital where things can get costly quickly. It can be very complicated when it comes time to settle the bill because the insurance carrier is not going to be on the same page with that out-of-network hospital. If they were, they would be in-network. They would have agreed to contract at the prices that are being offered by that insurance carrier. So that gives you an idea on the number one, provider section. And I'll tell you the good parts about original Medicare with a supplement in just a second. I'm going to get through a couple more of these disasters with Medicare Advantage. Number two on the list, might even be number one for most people, is referrals. With Medicare Advantage, especially HMO plans. HMO plans completely, some PPO plans also require a referral to go from a primary care to a specialist. So if you have a heart condition and you need to go to a cardiologist, first you have to go to your primary care and get him to okay it and write your referral to be able to go see the cardiologist. Same with a orthopedic. If you have a problem with a hip or a knee or something like that, before you can go to the doctor that's going to take care of it, you first have to go to your primary care physician, get them to okay it, and by them okaying it, meaning they have to get the insurance carrier to okay it, and then write a referral and go to the specialist. So obviously it can add weeks on the time it takes to go see the doctor that can actually help with what's happening. So referrals are certainly a big negative when it comes to Medicare Advantage plans. And along with referrals goes pre-authorizations. So not only do you have to get approval to go to the doctor that's going to help with what you need help with, when you get there, whatever you need help with, that doctor generally has to get it pre-approved. So a pre-authorization, generally they will say, you need this, this, and this. Right now we have to go see if your insurance company will pay for that. So it's going to be a week to 10 days before we're going to get an answer on whether they will pay for that. And then you go home, you wait for the phone call where hopefully they're going to say, yes, we got approval, let's go ahead, we can get things done. A lot of times you get the phone call where they say, I'm sorry, but the insurance company has denied that process and they decline to pay for what we feel you need to help you get better. So that's a really crazy part about Medicare Advantage health insurance is pre-authorization, where it's not up to the doctor on what you need. It's literally up to the insurance company on whether they're going to pay for it. You would always have the choice to pay for it yourself, but what in the world would be the point of having insurance if that's going to be the case? So that's certainly another big part of understanding how Medicare Advantage plans work. And lastly, for now, out-of-pocket maximums. So out-of-pocket maximums, what you'll find with Medicare Advantage plans is they can be very attractive coming in. Some of them can have zero premium, but when you use them is when the cost actually happens. So for 2023, the maximum out-of-pocket limit for a Medicare Advantage plan can be as much as $8,300. So $8,300 could be your out-of-pocket limit for a Medicare Advantage plan. And if you were to go into a PPO plan that had out-of-network benefits and you utilize somehow that out-of-network benefit, it can be significantly higher than the $8,300. So that's just for in-network. Out-of-network can be upwards of $10,000 or more. And again, that's if you find a provider out-of-network that'll actually accept you coming with a plan that they don't contract with. So very complicated. So the out-of-pocket expense can add to the overall stress of everything that's going on, where it's going to cost a significant amount of money in addition to having the medical condition, whatever it may be. So that's on the Medicare Advantage side. On the Medicare Original, A and B with a supplement, generally none of it. So with Original Medicare with a supplement, you can literally go to any doctor, any hospital, anywhere in the country that accepts Medicare. You are not restricted to any network whatsoever. If they accept Medicare, they will accept you as a patient. So whether it's in Florida or California or Maine, even Guam or Virgin Islands, Medicare Original has no network. So you don't have a limit if you had a significant scenario and you wanted to go to the Mayo Clinic or you wanted to go to Duke University or wherever it may be, if they accept Medicare, then they accept you as a client. So very simple, and again, nothing to be concerned with there. And if you're unhappy with one, you've got a multitude of others to choose from. And original Medicare requires no referrals. So you don't have to get that approval from a primary care to go to the doctor that's actually going to help with what you need help with. You don't have to ask for permission from your primary care, which would likely be a nurse practitioner because the primary care likely wouldn't see you under a Medicare Advantage plan. But you don't need that with original Medicare. You can go freely from one doctor to another doctor without having to get a referral. There will be cases that some specialists will want a referral because they want to make sure that their time is well spent. Cardiologists, for example, may want you to see your primary first to make sure it's an issue that requires a cardiologist. But outside of that, there's nothing on Medicare side that requires you to get a referral. And then the last part, but not least, out-of-pocket expense. With a Medicare supplement and original Medicare, out-of-pocket is super low. So yes, there is a premium for a Medicare supplement. We generally try to keep it as close to $100 a month as we can. So whether it's a Plan G or a Plan N, you'll likely be close to that $100 a month mark. But when you use it, there's almost no out-of-pocket expense. On a Plan G, your out-of-pocket for the year is $226. On N, you have that same deductible of $226, and then it's a $20 copay when you go for an office visit. So the out-of-pocket expense will get nowhere near that $8,300 or more on a Medicare Advantage plan. Significantly easier to use, much more flexibility, much greater control over your health care, which is really why I would never personally choose a Medicare Advantage plan. I would always do whatever I could to stay with original Medicare and with a Medicare supplement. Now, I absolutely understand sometimes $100 a month in premium is too expensive. If you currently get subsidies from the government, or you're on Medicaid, or you obviously have significantly low income where you just can't afford outside of rent and food, then Medicare Advantage is likely going to be the choice, and you want to find the best that you can within that parameter. But if you have the ability and you want control over your health care and you want to do whatever it is you want to do when the time comes, then original Medicare, A and B with a Medicare supplement, you'll likely add a Medicare drug plan. And again, it all bundles together. It's generally including your Part B premium. Your Part B premium, you're going to pay regardless, whether you're on a Medicare Advantage plan or whether you're on original Medicare. You'll always pay that Part B premium. Combined with that and the supplement with original Medicare, it's almost always less than $300 a month total for everything combined, put together. And then your out-of-pocket expense when you use it, super low. So that's really the reason. To me, it's just almost a no-brainer. It doesn't make sense to really look at anything other than that. So I hope you found this helpful. I'll show you right now how to download my book, Medicare Made Clear. Give us a call. We'd be happy to help. You can fill out your information on my website. We'll send you a quote on Medicare supplement plans so you can see exactly what they cost in your zip code. And we're here to help whenever you need it. Have a fantastic day. Thank you for taking the time to watch my video. I hope you found it very helpful. A couple of other things that you'll also find very helpful. Number one, download a copy of my free book, Medicare Made Clear. I spent a lot of time and a lot of effort putting this together, and it has everything that you need for Medicare now and in the future, down the road. I have videos in the book. I have all the links that you need for things that you'll want to do within Medicare. You can access it right in the book. Very easy to do. Just visit MedicareOnVideo.com/free book, and you can download it for free. You can save it on your computer. You can save it on your iPad. It's a great resource to have, again, for now and in the future. Another thing that you'll find helpful is down the road, when you come into Medicare, sometimes it makes sense to do a price check on your Medicare supplement plan. So I made it very easy to do that as well. Just visit MedicarePriceCheck.com. Put in your basic information, and we'll email you a quote on your same plan that you have right now, a G or an N or an F, whatever it may be, and likely we'll be able to save $20 to $60 a month in premium, because a lot of times plans come out with better rates. So if we can get a better rate for the same plan that we currently have, just makes a lot of sense. And then obviously take advantage of all the information on my website at MedicareOnVideo.com. I have everything that you need right there for understanding IRMA, understanding employer work coverage, everything that you need, especially in the guides and forms section, you'll find right there. So we update everything every year, so everything should be up to date and current with the right deductibles and premiums and things like that. Hope you found all this helpful. Have a fantastic day. Wait, don't go anywhere. There's a couple more videos right here that you'll find very helpful with your Medicare journey. So take just a minute, watch the videos. You can also subscribe to my channel by clicking this button, and that way you'll have access to all my videos for everything that you need for Medicare. Hope you find it helpful. Have a fantastic day.